Thanks for staying with us. So yesterday we started a conversation about the sponsored bill seeking to curb brain drain by mandating Nigerian medical doctors to practice for at least 5 years in the country before going abroad. Now, this has passed the second reading in the House of Representatives. So joining us right now today are all the key major stakeholders concerning this conversation. We have with us Dr. Uche Roland Ojima, who is the president of Nigerian Medical Association. We also have the Honorable Ganiyu Johnson, sponsor of the bill himself. We have Senator Yahaya Olorigbe, who is the chairman Senate Committee on Health. And they'll all be joining us to have this conversation. But let me start with Honorable Ganiyu Johnson. Good morning, Honorable. Are you there?
I'm here. Good morning.
Thank you for joining us this morning. So you sponsored this bill. I know you've been talking about this for a while. Let's start from the beginning. Why did you think there was a need for this bill in the first place?
Okay. About a year and a half ago, I sponsored a motion seeking for the upgrade of our medical facilities, review of welfare packages of medical doctors, and government to collaborate with private sectors, especially insurance companies, to fund the project, because the motion was on medical brain drain. All right. So the second part of it is to now look at the law, because the decline, the capital flight of medical personnel was becoming unacceptable. Because with 200 million people, we have been chasing very few doctors, and we are below the World Health Organization standard. A doctor to 600 people. In Nigeria, a doctor to almost 20,000 people. It's unbecoming. So I now say, okay, fine. What we can do is to look into the laws. I know after graduation from medical school, you do your housemanship 1 year. You do your NYSC 1 year. So instead of this capital flight, we can now, find an IP, a stopgap that people can now remain and stay another 3 years, cumulatively making 5 years. Within that 3 years, they can also do their residency. It's win-win for them.
Right.
They can start their residency program. So
right.
that at the end of the day, when they start their residency, they are specialists. So they can, after that residency, they are free to go.
Right.
That's all. That's the means.
Okay. Let me pause you for a second, because
I'm looking at Nigeria as a whole.
Right.
That we have over 200 people.
Right.
Chasing very few people. And we still have these doctors going, government has trained them, and somebody is like low-hanging fruits for the people abroad.
All right. Let me pause you, sir, for a second, because I'd like to bring in
Okay.
Dr. Ojima here. Dr. Ojima, the Honorable has told us the reason why he proposed this bill. He's trying to solve a problem. In your view, do you think this is the best solution at this time?
Thank you very much. I don't know if you can hear me clearly.
Very clearly, sir.
Loud and clear.
So thank you very much. While I want to thank everybody in the studio and others that are listening, I also thank the Honorable, because it has become clear from the bill he sponsored that there is a great need for the Nigerian doctor. That's one thing that has been established. Though the intentions of the Honorable may be honorable, if I use that word that way, I don't think he really looked at the implications. The solution to diarrhea cannot be plugging the anal orifice. You don't just block it and say, let the diarrhea continue to stay in there. And of course, the solution to brain drain cannot be enslavement. None of the two is good. Now, what I want the Honorable to understand is that the solution to a problem lies in finding out the origin of the problem. Why are Nigerian doctors leaving? Why are they emigrating? It is because they are not loved in their country. There is no love for the Nigerian doctor. The government doesn't love the Nigerian doctor. The patients don't like the Nigerian doctor. Maybe it's a psychological thing because we take care of you in your moment of weakness. So you have developed this aversion to that person that you may be seen as playing God. Why are Nigerian doctors leaving? They are poorly paid. There is no security. They are being picked up like granules. They are.
Hello, sir. We lost you. Okay, so we lost him for a moment. But let me let the ladies jump because we also have Senator Yahaya also, who is also okay.
There must be a policeman around. So we need similar things for us also to function very well. And now, one thing I want honorable to remember is that at that moment you pause for 5 years, you cannot have a youth corps. A medical youth corps cannot emerge for 5 years because you need a full license to practice on your own, which is what happens in youth service. Nobody can join residency training because you need a full license to also do that. Nobody could become a medical officer from that batch for 5 years. And therefore, we will end up enslaving the Nigerian doctor and not having one that will work for us at a certain cadre. So there will be empty.
Hello, sir.
We're having network.
Okay, so we keep losing our guests, but let me just try to redirect the question to, I don't know who you want to ask.
Okay, so I don't know if this is going to be a question, but I like the way Professor Ojima started by saying you don't solve a problem from the top. You have to find the root cause and, look at all the angles before you start preferring solutions. And you must consult with stakeholders and people who are direct beneficiaries of this particular, ideology or law or bill that you're passing and see how they feel about it. So this thing that the Nigerian educational system is highly subsidized, I beg to differ, because it's not like we are at the best or we are international best standard is what we are giving in our educational system. Of course not. Our educational system is cheap because of the level of the education that we are given. So if you say the Nigerian educational system is subsidized and so people should stay back, doctors should stay back and give some time to the country before they relocate, that means it's not just only doctors that it will affect if you really want to look at it. Even people who studied economics, political science, as long as you are in the Nigerian system, you must stay back and give back if you truly say that the educational system is subsidized. What this bill is going to do is it will make a lot of people choose not to study medicine. Because the truth of the matter is everybody wants to preserve. Your parents cannot suffer, send you to school, and then you are kept from having the life that you desire. So have you looked at it from that angle where students might decide to, okay, why don't I go for something like physics or chemistry or what's that one? Biochem, instead of studying medicine so that they do not delay me from leaving the country. Do you think this will actually solve the problem?
That's probably to Honorable Gani. Oh, go ahead. Go ahead.
Is it for me?
Yes, go ahead, sir.
Okay. For me, I think we are not solving the problem. I told you in my preamble that the first thing I did was to raise a motion. And that motion on this brain drain. And in that motion, I highlighted my prayers to you, looking at the welfare package of medical personnel. Also, some of our health facilities, such as the public health centers, to be maintained and upgraded to general hospitals. General hospitals to be maintained and upgraded to specialist hospitals. The specialist hospitals to be maintained and upgraded to research institutes. And finally, I said government to collaborate with private sectors. Private sector, especially the insurance companies, that will be able to finance, fund the project. With that in mind, I believe that even the 5 years, like I told you, the 5 years period I'm talking about, is inclusive of their housemanship, it's inclusive of NYSC periods. The remaining 3 years will enable them to embark on their residency, which make them specialize in their different fields. So at the end of the day, it's win-win for them and for the nation. Because
Right.
at the end of the day, we will have specialists in various fields.
Right.
And we'll be turning out, it's a cyclic thing. We have students in medical school that will come, they will still do residency, they will still do NYSC. It is a cyclic thing.
All right.
So, in a period of about 20 years, you see that Nigeria will be a place where will be like India, where people will now come to Nigeria for surgery. I mean, we can even generate revenue from it.
Well, let me pause you for a second because I would like to bring in Senator Yahaya Oloregbe in this conversation. What are your general thoughts on this bill? Let me come to you before we go on a break.
Okay. Do I go ahead, please?
Yes.
Yes.
Hello, Morayo.
Yes, you're live. Go ahead,
Oh,
please.
thank you very much. I think my general thought is that the bill does not look at the issues in a more comprehensive manner. First and foremost, just like your colleague has said, it's not only medical doctors that are exiting the country or migrating from the country. We have all kinds of professionals. But let's come to even within the medical profession or the health profession. It's not only doctors that are existing. We have nurses going in drugs, even much more than doctors. The other thing is that he does not, with due respect to my honorable colleague, the doctors that are leaving are not even the fresh graduates. Unfortunately for our country, are those that have been trained and specialized on the specialization that are almost finishing. And in terms of critical needs, those are even more critical than the fresh graduate that the bill is trying to propose for them to stay more for 5 years. The reason is this: most people or most countries don't take in fresh graduates. They try to take in people that are fast further training after graduation. In fact, within the profession itself, the Medical and Dental Council of Nigeria by last year had to institute a kind of system to prevent people that have done, we call it, when you are specializing, it's a 3-stage thing: primary, part 1, and part 2. After part 1, which means you have spent an additional 4 to 5 years post NYC, then you only have to produce a dissertation. By that time, you can be given a membership. With that membership, countries are taking them on. And mind you, the countries that are taking are not even developed countries only. We have the Eastern countries. So that's one issue, to say that when you are looking at issues of health professionals, we have something we call human resource for health management. So a bill like this does not, in fact, it's not looking at the issues at all. It's not about talking about fresh graduates.
Thanks for staying with us. We still have our guest with us. Tokwe had a question for one of our guests.
Senator Yahaya Oloregbe, yesterday when we started this conversation, I mentioned the fact that the real beneficiaries of this policy, if pushed, will be the average Nigerians. And from what you're saying, it seems like you don't see the merits in this conversation. What would you propose as the ideal short-term solution to the crisis we have in medical practitioners migrating?
Okay, thank you very much. I think my proposal would be to look at the issue comprehensively from the issue of our production of health workers. How do we produce it? How do we utilize them? As well as looking at the investment we are making to health in terms of production and utilization. Just like somebody said earlier, even the education, in terms of training, what do we contribute? Of course, the law is bringing everybody together. Now we seem to have less number of people, unlike before, being produced through the public sector, because there are many more private universities that are producing health workers. We have also a lot of Nigerians who train abroad, who pay for their own. So these ones, we cannot say you want to even bond them. But even those that are going through the public sector, we have less number of people studying science now. It means we have to start from there. Now, two, is what we have said, the problems of people going out are because of remuneration, because of working tools, working environment. When we talk about working environment, a doctor posted to rural area, we have to think about where will my children get school, what will happen to my family, then the issue of security. So we need to look at all those issues. There are issues within the sector, there are issues without the sector. Except we look at them comprehensively, we cannot just come and say we put a ban on fresh graduates. And as I said earlier in my earlier submission, in fact, the doctors that are going are not the fresh graduates more. There are more of those that are who have had some postgraduate level of training. And those ones are the people that we have invested much more resources on, and those are the people that will need more to deliver quality health services.
So, sir, you just highlighted the problems we haven't solved. You know what I'm saying is, what will be the short-term solution? What can, because in your position, what are you going to move to ensure that we at least stem this?
Let me direct that to the enemy, Doctor.
I think the short-term solution, which is part of, is about improving the working environment or working conditions of health workers generally, not doctors in Nigeria, so that more will stay. There's nothing we do, no matter how much we pay and so on, you still have some people will go for one reason or the other, as it happens in every country in the world, particularly developing countries. Even in the developed countries, I was in Ireland of recent, and I learned that nurses and so on train there from Ireland go to Australia. Yes. That is from developed one to Canada. But in our own situation, the short-term solution is to increase our investment in health. Currently, the resources we allocate to health in the country is very small.
It's not
to
enough.
be able to get resources to retain health workers generally.
All right, let me come to
Hello, Morayo.
Yeah, we heard you very clearly. Thank you very much, sir. Let me move to Dr. Jima, the president of the Nigerian Medical Association. I have always had the standpoint that you can't stop anybody from leaving, but you can attract them back home, because there are lots of Nigerian doctors who live abroad who will be willing to move back home. What is NMA doing to provide some kind of enabling environment to attract Nigerian medical practitioners across board from wherever they are to come back home?
Thank you very much, Morayo. From the perspective of Nigerian Medical Association, I wish to inform you that we are in constant touch with all the unions of the Nigerian doctors in diaspora. In fact, we have a blog where I interact regularly with them. Let me also tell you that some of them, like the Association of Nigerian Physicians in the Americas, have been having medical outreach in Nigeria, trying to give back. Let me also inform you that as we are talking now, they are actually shocked that somebody contemplated enslaving Nigerian doctors, and they will put out their position very soon worldwide. So we are in constant touch, and it's not as if they don't want to come back. They want to come back, but come back to what? Come back to a house officer earning 214,000 naira a month. Come back to a medical officer earning 330,000 naira a month. You can come back to that.
So are you still there? I think he's frozen. He might be stupid. Hello, sir. We lost you.
NYS is all about, if we are not paying back, where you go to earn 15,000 naira as a doctor, 15,000 naira as a doctor. Is that not enough? Must we give our blood? Because we pass through the same system that everybody passed through.
Yes, now.
Look, there is no two ways about it. If you want me and you need me, you have to sit down with me to discuss. And we have sat down with the Ministry of Health and a committee set up on curbing brain drain. The Nigerian Medical Association have put forward their memorandum clearly. You have to pay these people a living wage. You have to improve the security situation. I'm sure you saw my press conference, a press briefing on a doctor that was murdered at Ohara. Nobody really of note. Forget what they say. When you go to them, they tell you some people have been arrested, but that the principal culprits are on the run over 3 months now. Doctors are being attacked because patients and their relatives are upset by the economic situation. So any minimal thing they attack you, we need to cover all those issues. We want the national legislature to make a law to protect us from violence against health workers. Let me also point out that it is worthy to tell Nigerians that for over 1 year now, a bill to amend the Medical Dental Practitioners Act to bring it up to speed with current realities have been sitting in the National House of Representatives waiting for concurrence for more than 1 year, haven't been passed by the Senate and sponsored by Senator Olori Ekpe. We thank him very much. But please, can the National Assembly please pass give concurrence to that bill to properly regulate medical practice that has been brought up to speed and has been with them for more than 1 year. The Nigerian doctor is patriotic. That is why some of us are still here. Madam, if you give a man a car loan or give him a mortgage to have a house, will he run away before he finish paying all those things? They know what to do. But there is what is trying to come now that is like legislative dictatorship, is what I call it. It's legislative dictatorship.
Let me get
so
you.
let them calm down and let us sort out this matter amicably.
All right.
Thank you.
My question is just to the senator. You heard what the doctor said. Don't you agree with him? And shouldn't you be...
Okay, that's for the House of Reps, Honorable Johnson, who actually proposed the bill. Sorry, why can't take some water?
But I can't hear them again. Maybe they've...
Honorable...
I am hearing you too.
Honorable Ganius Johnson, can you hear me?
Yes.
Yes, YK has a question for you. Go ahead, YK.
Yeah, did you hear what the doctor, the enemy president said? To me, it makes sense. If you make the doctors' working conditions good, give them a car, give them a house, give them things that they will not want to leave.
In my opening remarks, that was what I told you.
Yeah.
I said there will be an upward review of their welfare working facilities, health facilities. So if we do all that, why should they leave?
Right.
So I highlighted all those ones down.
Okay.
Yeah.
I don't know.
But when it comes out...
there is still an opportunity. Madam, there is still an opportunity for public hearing.
Okay.
During public hearing,
yes,
there
just
will be
yeah.
one debate.
Conversation is
So, I mean, this is just a preamble. It's just second reading.
Right.
It's still a long way to go. There will be public hearing. People will come. We will debate. Disagree to agree. We just want the best for our nation. That's all.
Awesome. So I like the fact that there will still be a public hearing so that people can, air their views. But I wanted to ask you, does this bill cover maybe our leaders' children who probably school abroad? Or, private individuals who have children who study medicine abroad.
In Nigeria.
Only those people who study in Nigeria. So this is, disenfranchising a lot of people who are hoping to have a better life after school. Excuse me, sir. I wanted to just land this point, sir. Because if our leaders...
Let me tell you, if they are abroad, they study school abroad, and they are practicing abroad, I mean, I can't force them to come.
Okay. So this again is going to disenfranchise the poor who cannot afford to send their children abroad to study. But we have leaders who are able to send their children abroad using our taxpayers. Hold on, sir, now. Let me land it, sir, please. Using taxpayers' money to send their own children abroad, those children are not disenfranchised. But we have our people who will be disenfranchised. So this, I repeat again, will make a lot of people feel there is no point in even doing this course in the first place. So I'm happy that we're having...
I disagree with you.
Okay.
I completely disagree with you.
Okay,
if
sir.
you see, medicine is a humanitarian job. If you have passion for medicine, if you have passion for it, no matter what you still do it, you're still going for it. You are not going there to make money.
Wow.
Yes.
So passion will kill us now.
Money that is important. You want to save lives.
Interesting.
That's it.
Okay, let me go on a break, because sometimes when we have these conversations, we forget the most important people in this conversation. That's the Nigerian poor man who is hoping that the doctor that is treating me right now is not leaving in the next moment. You see, some of us can afford to have private doctors take care of us, but others don't.
Yeah.
So, we can see a lawmaker trying to propose. So the real conversation is, what's the real solution? As you said, short term, where today that doctor doesn't leave and can treat. Let's go on a break. Thanks for staying with us. We still have our guests with us, and we're still discussing this matter. Let me come to Honorable Yahaya Oloriegbe, based on what is...
Just finished.
No, that was
okay,
Ganiyu, that was earlier. So, on Senator Oloriegbe, let me come to you. We had asked earlier, because my concern...
Hello, Morayo.
Yes, I'm glad that you're still there. My concern has been the fact that, you know, we all want...
Hello, Morayo, I can't hear you clearly.
It's very faint.
Okay, let me then come to NMA, the president of NMA, since I can't hear Senator. Dr. Jima, can you hear me?
Both of us are not hearing you clearly.
Both of us are not hearing you. You are very faint.
Wow.
Okay.
The people handling it.
So,
now you are clear. Hello, Morayo.
okay,
Yes.
they
Can you hear me now?
Yes, you can.
I can hear you now.
Okay, let me start with Senator Yahaya Oloriegbe. My concern is the fact that everybody is looking for some kind of a getaway for success. Everybody wants a better life. But again, there are people who don't have access. So, and my worry is that even though this bill tries to solve a problem to retain doctors, which you have told us that it's not even the newcomers that are needed. It is those who are well-trained that are living in droves. So you said welfare is a solution. But the truth is that the government will tell you at this moment that how fast can we provide adequate welfare for all the doctors? Could you give us an idea of what kind of welfare you mean? Is it just for the houses and the cars? Or what exactly do you define as welfare to make our doctors stay back in Nigeria?
Well, I think basically it will be one appropriate remuneration that will be what we call living wage for the level of the profession that they are. I'm not talking of doctors alone. I want to speak for the health sector generally, because it's not only doctors that are living, including nurses and so on, because doctors cannot work without other professionals. Two, it is those conditions that just like NMA analyzed, which used to be there before. You have access to vehicle cars, you have mortgage for housing, and then you have education allowances and so on for your children that enable your children to be able to go to school that become necessary. These are possible if we increase investment to health, if we increase allocation to healthcare. For example, now I'm aware of the budget. We have huge resources that are going to certain sectors of the country that are, if you look at national budget, you see what is in labor, you see what is in agri, and you don't see the physical thing there. This can go into health education.
Senator,
I will be able to get
let me cut in right here. Let me cut in here, because do you know that there's no amount of money you can give any profession in Nigeria that will match what they'll get internationally? Yeah. So where does the part of patriotism come in?
Yes, you may not match internationally, but you will have more staying. You see, whatever what you give, as I said, some people will still go. But now it is extremely too poor. There's other issues that I didn't mention. There's the issue of people getting jobs. As we talk about, there are doctors who, after finishing even their specialized training, they don't get placement. So what do you expect those people to do? Because there's no money. If you go to many of the teaching hospitals, they have vacancies that are declared, but they will say there's no money, particularly the one in the federal government that I'm aware of. And in many states don't even recruit doctors. So we see, even despite the fact that people are going, not all that we have are able to get placement for them, particularly those that are specialists. After you have been trained, after the residency program, you have to exit until when there's a vacancy. So the vacancies are not always declared. So for those people, they move on. So these are some of the issues that we are talking about. So we have to look at it comprehensively immediately. So it's not about just banning for 5 years.
All right.
It won't solve any problem at all.
Okay.
So there are many quick wins. The quick wins, as I've said, the remuneration you are talking about are easy quick wins, because once we have more resources, the working conditions are quick wins. We should also, once we put more investment, we'll be able to place more doctors. Right. Because we also have to, there are areas, in the rural areas, in areas of insecurity, you don't have doctors trying to go there. So these are issues that a new government, that when they come here and they look at this comprehensively, can be able to solve. But of course, we have to address non-health issues also to make people to stay.
Okay, so yes, there are many angles to solving this problem. I was going to first ask the NMA that did the NMA president look at the document that has passed the second reading? Because I remember the senator, from what the senator said, it seems like a whole lot was already covered that it seems the enemy isn't highlighting. So the first question will be that, did the enemy look at the document that has passed second reading, and do they feel that the entirety is just not worth it? Because one of the issues the enemy highlighted was the fact that people cannot, they cannot wait 5 years before having their housemanship. But the senator said the housemanship was already included in the 5 years. So it seems that the enemy might not have gone through the document appropriately. That's one. Number two is going to short-term solution. Because when we talk about, when you run organizations, you can't always compete financially with other, in terms of remuneration, but you look for non-financial remuneration, some of which we highlighted. So I like the House of Rep, the honorable that pushed this bill, that what are the things that can be done non-financially in the short term, providing loan services for people to get mortgage, because if somebody is earning 350,000 naira, with 3 children or 4 children, they cannot afford to pay for good schools or even be able to buy a house with that income. So what are the short-term solution that can be added into this bill to see how we can go through at the moment? Yeah. There's a whole lot more to say, but...
Thank you very much. I believe it's for me.
Yes.
We looked at the document clearly. We have gone through the document. You see, what I was pointing out was not that you can't do your house job. But you are now perpetually left as a house officer for 5 years, no matter the terminology he uses. As long as you don't have a full license. You are a house officer for 5 years. Let the honorable understand that.
Yeah.
Because after that 1 year of internship, where you practice with a temporary license, you quickly go for your permanent license. And it is now that full license that will make it possible for you to be called up to become a youth corper. Without full license, you cannot practice unsupervised, which is what the youth corper does. So in essence, Honorable wants to create a house job that will last 5 years. And in essence, no government institution will employ you as a medical officer without full license. Nobody will employ you into residency training without, in fact, you cannot even sit for primaries to join residency training if you don't have a full license. These are the things I want the honorable to understand. I'm not saying that people cannot do house job. No, but you are stuck in house job for 5 years. That's what honorable is proposing.
Right.
And the second thing I want honorable to remember is that there are people that don't train in Nigeria. There are people that train abroad that come back to be inducted and then have their house job. They will also stay for 5 years without being sponsored. Or is there a point where it gets to they say those that trained abroad continue, those that trained at home stay back?
You can always adjust
and against the Constitution of the Federal Republic of Nigeria.
Right.
Now, quick wins, like you pointed out. See, the Nigerian doctor is not asking for the whole world. They just ask to be treated better. The people should take their knee off our neck. We are joking. We are joking badly. You see, why am I still in Nigeria? Because this is my land. I am a black man. This is my place. My food is here. My water is here. My people are here. My social dependence is here. For me to uproot and move is an extreme decision.
Yeah.
And we don't take it lightly. So if we are not asking to be paid what they pay in UK or what they pay in USA, we are asking for what is commensurate for our own environment that the government we know can afford. We are asking to be treated nicely. As of today, based on the amended Personal Income Tax Act of 2012, we are, or 2014, no, 2012, we are being taxed for everything, including our core allowance. Can they take up some of those taxes that will increase our earnings? And also sit down to look at the welfare situation. We are talking about federal government workers everywhere. Why can't we talk about state government workers? How much are they paying people in states that they will not leave? The brain drain is hitting the states more because many of the state governors don't pay well. They don't even pay what the federal government pays. There are very few of them, like Delta, Akwa Ibom, and a few other places that pay well. Others still pay what doctors used to earn by 2009 and backward. So if you can look at adjusting the tax laws to increase our income, also adding more to it, because as it stands today, some people are being given 40% of their salary as whatever allowance, while we are being offered some things like 23%, and it looks ridiculous. So they should take us seriously and stop trying to force us to stay.
All right, thank you so much, Dr. Ojima. Let me quickly come back to, I'll come to you, Mike, in a second. Let me go back to Honorable Johnson, because Dr. Ojima had said earlier about a bill that is still pending at the National Assembly. Hopefully this bill is supposed to also include welfare reviews and some kind of package to allow doctors be able to stay. What is going on with that bill, and how far do we have to wait, or how long do we have to wait for it to be passed?
I'm not in a position to comment on that, because I don't know the level where the bill is. You know, we are on recess now, so I'm not in a position. Okay. Let me quickly react to what the senator said about the 5-year ban. See, the 5 years, like I said, is inclusive of the housemanship, all right? And after the housemanship, as of today, what they do after housemanship, they give them full license. All I'm suggesting is that instead of the full license, they can give them temporary license, so they can be able to operate. So they go and
they can't travel.
No, they do their, what's it called, NYSC. They can go and do their NYSC. After their NYSC, they come back, okay? The remaining 3 years, that will even enable them to register for their residency, which is a specialist course. At the 3rd year, at the end of the 5th year, you know, I mean, they will be given full license while they are staying in their residency. The residency takes an average of 5 to 6 years before they qualify. Do you understand? So it's like a stopgap for the nation. I'm looking at it holistically. I'm not looking at doctors who, no. What is our nation going to benefit from this system? It's like low-hanging fruits for us.
Low-hanging fruits. Okay.
Yeah,
we understand the concept. Otherwise, we will continue to go round and round. That's why I say, no problem. There is still room for public hearing, where there will be robust debate on this.
All right. Let me get it. Go ahead, Wake.
All right.
I have 2 short questions. One to the Honorable. Have you sat down with the NMA, or do you think you should sit down with them before you...
Yes, to fine-tune the bill.
Yeah, because that way both of you will work with the same, in the same course.
What's the same objective, yeah.
And then to the doctor, I wanted to ask, because we are talking about the government, but I know of private hospitals that do not pay their doctors well. And a lot of the doctors from these private hospitals leave. It's not just the government doctors that leave. The private hospital doctors too leave.
And the government can't employ everybody.
So what, do you lean on these private hospitals to pay their doctors well? Because I have had personal experiences of my doctor leaving as I was having my baby.
Right.
This was
way back.
Years back.
There are 2 questions. Let me start with Honorable Johnson. Waike was asking about who did you consult before this bill, or have you consulted with NMA?
Yes. No, you see, we have medical doctors in the house that are members of NMA. We discuss.
Okay.
Okay, so I cannot do it on my own.
Okay.
So I shared my views with them,
all right,
with the in-house doctors in the house.
Okay. Can I come then to Dr. because we have a little time. Dr. Ojimba, let you answer Waike's question. Ojima, answer Waike's question.
Yes, I heard what she asked, whether we lean on them. Of course, we are doing our bit. As of now, we are working on them. But you see, the fundamental thing is that we may not have a power of execution. We are working to push for what will be known as basic minimum acceptable salary for an average Nigerian doctor. But if government can pass it and make it a policy that you cannot go below this level, it will work. But if NMA is supposed to go from hospital to hospital to chase them, it cannot work. We believe that we need a basic minimum acceptable salary.
Right.
Like you said too, most of these doctors in the private sector, it is their investment per se. And so the limit of interference is minimal.
Right.
We urge them to pay their people well while we are pushing for what will be known as basic minimum acceptable salary for the doctor. Okay. Of course, the loss of service, human resource for health in the private sector of healthcare is immense. Some of them, their own hospital will tell you that, in fact, if you treat the doctors well, the young doctor will call you from the airport and say, well, I just don't want you to be stranded. I'm leaving. I'm at the airport already. So we'll keep on working. I believe that if we set a standard template, it will apply across board.
Okay, we have to wrap up. So let me just take the final question.
Yes, so, okay. Yeah. I quickly want to add, since we're going to be having a public hearing soon for everyone who would be a part of it, to fine-tune the bill in such a way that it would include, first of all, making sure that the welfare of these medical practitioners are enhanced, you know, as a way of keeping them, and also ensure that each governor is able to get grants and support. They should source for it. That's one of the things governors should be doing for their people to improve their medical care. It should be a part of the bill so that you know that as a governor, you are getting into a state, you have a responsibility to ensure that your medical practitioners are well taken care of state by state before we now move on to, you know, getting more resources from the federal government. This also would help to solve the immediate issues before finally saying maybe some people should stay back or not.
In quick addition, I feel that there are some areas that we are not, we didn't touch on this show today, which is the part of the non-financial, which security is a major issue for many doctors, which is an issue that cuts across every sector. But if we can do these other things, which is not directly putting money into the healthcare system, improving educational sector, improving security infrastructure, we would end up having a better society that the doctors would want to stay to live in. So we don't need to put money, so much budget into the medicine, but improving general infrastructure would improve the livelihood.
I think we can wrap up. Let me let everybody just say one sentence to wrap up. Let me start with Honorable Ganiyu Johnson. Just a final word as we wrap up this segment. Your final comments on this, sir.
Well, I just want to thank you for giving me the opportunity to air my views.
Yes.
And I wish you good luck and happy Easter.
Thank you, sir. All right. Dr. Rolando.
You are doing a fantastic job.
Thank you, sir. Thank you, sir. Dr. Ojimba.
Thank you very much, Mariah. I want to plead with the House of Reps to please quickly concur to the Medical and Dental Practitioners Act that has already been passed in the Senate, that has been sitting with them for 1 year. I want to call on the National Assembly to please make a law to improve the welfare of Nigerian doctors. They've made many laws and it has been implemented. Finally, let them remember to make a law to control medical tourism. That is where we are losing greatly. Yes. Thank you very much. Thank you.
Senator Olori-Egbe, your final words.
Thank you very much. I think the thing that the bill has brought is to bring to the fore the challenges of human resource for health in Nigeria. And I think it will be an opportunity to use this to have a conversation around how we retain our health professional in Nigeria, to look at it comprehensively, but not just to say the bill, to say come the 5 years for the fresh graduates, but to look at it, and just as we discussed, at what are the quick wins, what are the medium terms and long term in terms of retaining health workers in Nigeria. And I think this would be important, especially since we have opportunity of a transition of government now, to see that we retain more of our health workers to provide quality health service for our people.
Thank you very much, gentlemen, for joining us. I mean, I'm happy that the National Assembly is thinking about this brain drain that we're losing and medical tourism to other countries. So it's a good solution. It's a good first step that they're looking for solution. However, we've heard so far that this proposed solution is still inadequate. It's not going to solve the problem. They need a more robust bill to ensure that we keep our doctors and also to attract them from coming to come back home. That's all we can take on this. Thank you so much, gentlemen, for joining us this morning.